So my name's Dr. Lerman. What's your name?
My name's Steve Sprague.
And where do you live?
New Jersey.
And we're here to talk about your hip arthritis, right?
Yes.
So you came to me because you had hip arthritis, correct?
I came to you because I had pain. You were the one who diagnosed it as some hip arthritis, yes.
But you had had pain for 20 years, I think you told me.
I did, yes.
So it's been bothering you for 20 years?
Yep.
Did you ever go see doctors about it?
No, I didn't. Because one thing, I didn't really want to be told I needed hip replacement surgery. I didn't want to hear that. And I could deal with it. It wasn't really severe most of the time. But then just recently, it became like I couldn't go to sleep. There'd be pain in my hip, and I couldn't fall asleep. I couldn't lay on one side or the other because the hip would increase. I had to lay just on my back. So then I know that this hip degeneration gets worse and worse, and so I was afraid I'd be facing something like hip replacement therapy. But then I heard on the radio that you dealt with these kind of issues, and I was very anxious to deal with it with your technology.
Do you have friends who have hip replacement?
I had one guy I know, yeah, he had hip replacement surgery.
What happened to him?
Well, he was actually a hiker. He lived out in Montana. I went out to his little hiking program in Montana. So we did a hike, and he said it was the first time in 8 months that he could go on a hike. He had to take 8 months off from hiking. That was actually how he made his living. But he had to take 8 months off from hiking.
So it took him 8 months to recover from this surgery?
Yeah.
And did he have a good result?
I think so. He didn't complain to me about it, so I'm not a doctor either, but I think he did okay. But 8 months off is 8 months off.
So you wanted something without the downtime?
I didn't want the downtime. I really didn't like the idea at all.
And did you like the idea of having part of your hip removed and thrown in the garbage? And
I didn't understand how they could do it, and I sure didn't want to find out.
And what about the anesthesia and hospital? And not everyone gets a good result with anything, actually.
Yeah, so that's a major, of course it's a major operation, opening up a person's body up and removing bones. We thank God for such technology, but if I can avoid it, I certainly will. And when I heard that, I had heard your broadcast before, and then just recently you started talking about plantar fasciitis and hip and knee and joint pain, and I was like, wow, this is what I want to hear. The first time I heard it, I resolved to come here that day. The first time I heard that you did it.
Did you think it was possibly true?
Yeah, of course. I thought it was possible. I thought it was very possibly true. Why would you say it if it wasn't true?
Okay, so you came here. We met actually about a month ago or so.
Yeah.
And we got images to confirm that you did have arthritis, in fact, right? Because we don't like to treat people that don't have arthritis. We like to prove it. And you had the scans, and you had proof of the arthritis. And you weren't interested in injections and surgery and physical therapy and weight reduction. Those things didn't appeal to you.
Please. No, I wouldn't. I was very interested in not participating in major rehabilitation.
Okay.
I'm a very healthy person, basically.
So you had the treatment. Did you have any side effects from the treatment?
No.
So you had just a few treatments. You come in here, got your treatment, and went home or went to work or did your thing, right?
That's correct.
And was there any adverse interaction or result of the treatment at any time?
No.
Okay, and when did the pain start resolving?
After the second visit, it started resolving.
And what percent is, now you've had 6 treatments, what percent of the pain is now gone, would you say?
Well, right now it's 100%. It's been 100% for a couple of weeks.
So it's 100% gone.
With a few moments when pain emerges, and then in 2 or 3 seconds it goes back, gone.
And have you been taking any pain medicines? Or?
No, I had been wearing a patch for pain relief, but I'm not wearing that now.
So you stopped wearing that because of the radiation?
Yeah, with the pain, there's no more pain, so no more patch.
Okay, have you told other people about the results here?
Oh, I've told my friends I'm coming here.
Does anyone believe that the pain went away? Have you told them that?
No, nobody. If I tell them, nobody disbelieves me. They haven't said that they're interested in the treatment. Also, they don't have pain, I guess. I had a hard job. I stood on my feet all day, all night.
Can you describe your work?
I was working in the fish business, so I was cutting tuna, salmon for sushi restaurants, cutting heavy fish, big fish.
So some of your fish, I think you told me, were 900 pounds? So,
oh, yeah.
And you were lifting them yourself?
No, you don't pick up a 900-pound fish.
So what do you do?
You lay them on the floor and you cut them into pieces that you can actually pick up.
So how big were the pieces that you picked up?
Well, most of the fish now they got about a 80-pound loin. They're running 400 to 600 pounds. So 80 pounds was a pretty common number, and then you just move it from one place to another.
Would you be picking up 80 pounds of fish?
Yeah.
That's routine for you?
Oh yeah. Well, anything up to 100 pounds was just pick it up and put it on the table.
Most people don't do that.
Yeah, well, they don't have the opportunity to do that. I had the opportunity. Okay. But I ate that fish every day. I love it.
Are you still eating fish now?
Yep. I love my tuna. I love it.
So what advice would you give to someone who has pain in the hip, the knee, the hands, the shoulders, wherever? Are you a believer now, I guess?
Yeah. It makes perfect sense. I don't understand why the radiation does what it does. I don't understand the physiology behind it.
Well, we're trying to kill the inflammatory cells. There's inflammatory cells. There's cells that are inflamed, and we're trying to kill those cells and decrease the inflammation and take away the pain.
And so that's what you, as a doctor, you understand. So then I don't have to understand. I just get the treatment. I have the results. The results are good.
So everything's A-okay, no disappointment?
No, not at all.
Okay, any questions you have for me?
I mean, no. I don't understand why this technology isn't spreading all over the place and people should be using it everywhere. It's insanely easy to do this.
Well, maybe if you had a hospital with 20 or 30 operating rooms and you had surgeons who want to cut, and you had a crazy doctor over here at Radiosurgery New York who says he could relieve pain and helps many people, what would you do if you're the president of the hospital?
Mm-hmm. This is anyway, I'm 100% sure that this will be the technology of the future. If people find out there's no comparison. Walk in, change your clothes, walk out. That's it.
All right. Any advice for other people, or give it a chance?
Give it. If you have pain, go here first. Okay. It's cheapest. It's fastest. If it don't work, you can always have your hips cut out later.
All right. Thank you so much.